A major shakeup in America's vaccination schedule.
Joining us now to talk about it is local infectious diseases doctor Stephen Thomas. Good to see you again. Thanks for being here.
Appreciate it. Nice to see you. Thank you.
This is a decision by the Federal Vaccine Advisory Committee, all appointed, by the way, we should point out, by the Health Secretary, Robert F. Kennedy Jr. What's the change? Let's start there. The ACIP, which maybe people have heard in the news recently, familiar with. What did they decide?
Yeah, so to back up just a second, so the FDA, they make decisions about whether vaccines are safe and effective, and then the ACIP makes recommendations on how they should be used. So what we're talking about are hepatitis B vaccinations and the schedule, which up until recently was a newborn would get vaccinated within the first day of life, then you get vaccinated at 1 or 2 months, and then 6 to 18 months after that. And what the committee voted on, and it was sort of a split vote, was that they said, okay, you got 3 types of moms. You have moms who you know tested positive for hepatitis. You have B, and you have moms who you don't know the status, and you have moms who've tested negative. And what they said is that moms who test negative or who you don't know the status, those kids should not necessarily be vaccinated. That should be a decision between the mom and their healthcare provider. And then the moms who test positive that the kids should be vaccinated, they gave some leeway in terms of the timing of when that vaccination should occur.
Well, let's talk about the history of this. I mean, how long has this been the case where all newborns get the hepatitis B when they're born, and why do you think that was an important move?
Yeah, well, it's been about 30 years that they've been routinely vaccinating newborns for hepatitis B. And the reason that they did that was because there was a lot of cases of newborns getting hepatitis B, either from their mothers or from other people who were infected that they would come in contact with in their life. It could be a caregiver, it could be daycare, something like that. And you know, 90% of those kids who got infected would go on to develop chronic hepatitis B. And of the people who go on to develop chronic hepatitis B, 1 in 4 are going to have premature death compared to their uninfected peers, and 1 in 3 are going to have some kind of chronic condition like cancer. Hepatocellular carcinoma. So that was the reason why they implemented this, and the numbers dropped. So people 19 and younger, the numbers dropped by 99%.
I was going to ask you, how successful was that strategy? I mean, pretty
incredibly
much
successful.
Wiped it out, essentially, at that point.
Yeah, it went from having, you know, about 20,000 kids a year with hepatitis B down to about 250 was the last time that the CDC numbers. So, yeah, it was a very effective program.
The numbers speak volumes, don't they?
Yeah, data matters. Go figure.
So this has produced a good deal of opposition in the medical community, the change, that is, not doing it within 24 hours. You're someone that has for years studied things like this, vaccines, infectious diseases. What's your take, what's your opinion on this change to the hepatitis B schedule?
Well, again, you know, to your point, it goes against the science, it goes against the data, it goes against, you know, decades worth of safety and effectiveness information that we have. You know, you mentioned it. The people on this committee were handpicked by the secretary, and although many of them are ideologically aligned with the secretary, many of them really don't have the education, training, or experience to be looking at these issues, and certainly not to be making vaccine policy for the United States. So it's, you know, it's not a total surprise that these are the types of recommendations that are coming out.
And how concerned are you, and what could the potential impact be of babies not getting that vaccine as soon as they're born?
They're not protected. Yeah. They're not protected. Now, it's interesting, you know, they've done recent surveys of the American public, and the vast majority of people believe that hepatitis B is a disease that can cause harm, that the vaccine is safe and works, and that kids should be vaccinated. And over half of people believe that kids should be vaccinated within the first day of life. So again, this committee is not reflective of what the sentiment is in the public. But there, you know, there are people that they still look to the federal government health agencies to get guidance, and those people are giving guidance which most physicians and most scientists believe is poor guidance.
How much is this chipping away even more at people wanting to get vaccinated against flu, COVID, you name it, hepatitis B for their kids?
Yeah,
I mean,
yeah. It is chipping away. Again, for the people that have relied on the federal government to give them, scientifically backed information, medically sound information, they're now confused and they're wondering what to do when these, top agencies in the government are telling them information. They're confused as to what they should do, and so they're making decisions that may not be the best decisions for them or their families. Vaccination rates against COVID, so the updated vaccine, down by almost 30%. Influenza vaccination down, and we're having a ton of influenza here locally.
Right.
So yeah, it does chip away, and it's unfortunate because people, vulnerable people are being impacted, and their families are being impacted because they're getting bad information.
Is this a done deal? Going to be reversed?
So the secretary and the head of the CDC have to sign off. To my understanding, they have not yet, but I have zero doubt that they are going to sign off. So the tech investor and the lawyer are going to sign off on major vaccine policy for the United States.
So can parents still get their kids vaccinated, or does this prevent them from that?
No, it doesn't prevent them. They can still do it if they choose. From what I've read, the insurance companies have said they're still going to pay for it, which makes total sense because they're looking at paying for 3 shots to prevent a chronic disease, potentially fatal disease, a disease that can put somebody in the medical system for their entire lives, versus having to pay for all of the, years of care. So even the insurance companies know what the right thing to do is on this.
What would you like to say to a mom who's about to have a baby, dad about to have, a baby? There's a newborn coming into their life, and they're confused right now.
Yeah. I would go to the medical specialty societies like the American Academy of Pediatrics, the American College of Obstetrics and Gynecology, the Infectious Diseases Society of America. That's where I would go. I would go to your local physician, the person that or nurse practitioner or whomever you've been going to provide you good information. I would go to them. I'd go to Onondaga County Health Department, Dr. Anderson and her team. They have very good information there. That's where I'd be focusing my attentions these days.
There's still good sources out there.
There still are.
Appreciate your insight. Thanks, Doc.
Thanks.
Download the WSYR Plus app on your TV to stream News Channel 9 for free. Just go to your smart TV, search WSYR Plus in the App Store, and download to start streaming today.